Good morning, everyone. Thanks for joining so promptly. It's great to see so many familiar names joining the webinar. I feel like in today's times where we don't get to connect, just seeing your name in the participant list on the webinar just gives me a little boost. So thanks for joining today. We'll get started in just a minute as we allow others to join. Thank you. Good morning, everyone. And thanks for joining us for this FP2030 webinar, which is our first chance to dive into last year's measurement report. So thanks for joining. We're really excited to have you. Excited to share this first FP2030 measurement report. My name is Jason Bremner. I am the Senior Director for Data and Performance Management team here at FP2030. And before getting started, I will quickly review some key logistics for today's webinar. First, in addition to today's presentation, you should see at the bottom of your screen the usual question and answer button or pod where you can submit questions at any time during the webinar, as well as a chat window where you can send chats to all attendees or to the meeting hosts, particularly should you experience any technical difficulties. We have several people on the line who can help, and we have people who can provide help in French or Spanish. Today's webinar and slides will be in English, but there is simultaneous interpretation in French and Spanish. And before we start the webinar, everyone needs to select a language option, and please look at the bottom of your Zoom screen and locate the globe icon that says interpretation. Please select your preferred language, and if you are choosing French or Spanish, you can click on mute original audio if you don't want to hear the English narration in the background. Just a reminder that this webinar is being recorded and folks will be able to view it afterwards. So thank you again for joining us and for your participation. Next slide, please. As you can see here, we have a full agenda for the day. I say the day, but really it's just our hour plus together, and we've got a lot to cover. You will see a series of presentations on the FP2030 measurement framework and sections from our FP2030 2021 measurement report, including regional profiles, tracking family planning financing, and the impacts of the pandemic on family planning. But before we get started, I'd like to turn it over to FP2030's Executive Director, Samukeliso Dube, for a few words of welcome and an update on the FP2030 partnership. Over to you, Samu.
Thank you so much, Jason. I think it's good evening and good morning. And I don't know where I'm sitting in Johannesburg, it's good afternoon. I do hope all of you here are engaged in this particular process. And we thank you for, sparing some time to look at the measurement report. There is a maxim that says that what doesn't get measured was not done. But we believe that in the expansion, as we expand our work, as we expand our reach, and as we enable even our beneficiaries at the end of the day to be part of this process, we need to measure. And our challenge is obviously, as we want to measure, is are we measuring correctly? Are we measuring accurately? And are we measuring what matters at the end of the day? So I'm glad that you're all able to join. And I'm still like a month old in this particular position. It feels like already maybe a year, you know, because of the expanse and the depth of the work that is before us. So again, ladies and gentlemen, Jason and Tim and our partners, Track 20 and Avenir Health, have worked so hard with the Kaiser Family Foundation to make sure that we do measure what matters. So as we give them ear today, we do covet your support in ensuring that not only do we contribute to this process, but we stay attuned to making sure that the partnership then grows. As you know, we are launching a new era at FP2030, and that new era will come not only with newer modus operandi, but also in newer ways of doing work. So thank you so much, Jason, for organizing this, and thank you everybody, and especially our partners, those who are providing support and funding to make this work possible and feasible. We really appreciate your support. Thank you very much.
Thank you, Samu. As you're only a month in, we don't expect you'll be answering all of the hard data questions today, but certainly thank you for joining, and look forward to you answering questions about the future of the partnership that may come in our Q&A session as well. So during 2019 and 2020, FP 2020's Performance Monitoring and Evidence Working Group, or PME Working Group, assessed the strengths of the FP 2020 measurement approach, as well as the remaining challenges. And in 2021, we shared these changes in the measurement framework with FP 2030 partners. This year's Family Planning Measurement Report represents our first time reporting with this updated framework. So I will take a moment to talk about some of the changes. Next slide, please. First, the expanded geographic scope. As you probably already know, the FP 2030 partnership is now open to any country that wants to make a commitment. And we've expanded the geographic scope of reporting, which we'll come back to in a moment with a map and some numbers on countries. So hold on that one and we'll come back to it. We've also made changes to some of the country level indicators, including continuing our focus on annual estimation of contraceptive prevalence for all women, but also making sure to examine and report use among married and unmarried women. This change, seemingly simple, includes some updates to the model used in the family planning estimation tool that makes this possible. And so kudos to Track 20 team and other partners for their hard work on this. And this is also possible for unmet need and for demand satisfied with modern contraception. We've moved from reporting on additional users to total contraceptive users. Now, we've always estimated the total contraceptive users in every country, or the 69 FP 2020 focus countries each year. And we would use those to calculate the additional users since 2012. Now focusing on reporting the total contraceptive users allows us to look at programs more wholly. We see the total number of women who are using services, and it still allows programs to see changes in the number of women that they are providing services to over time. Last year, for the first time, we produced uncertainty estimates around many indicators. And that's something that has become common in other fields. So we were proud of that last year. And as we move forward, we will continue with this. This has been expanded this year and is becoming a standard aspect of FP 2030 reporting. While we continue to focus on reporting on modern contraceptive prevalence, we now report on traditional method use in countries where the practice is common. And when I say common, we're using a threshold of greater than 5% prevalence among married women. So you will find an interesting table in our estimate tables that gives light to traditional method use. We've formalized our aggregation of the supplemental adolescent and youth indicators, large data set available for countries on supplemental indicators, and a new country level dashboard on these indicators will be updated soon. Finally, we've added additional indicators, including the source of method, public or private, and a breakdown of that, and also the percent of births that are reported as unintended. And we look forward to diving into this data in future years. We've also made some changes to the method information index that will provide additional information in coming years as the DHS survey asks some additional questions. So again, stay tuned on that one. These seem like subtle changes, but they require an immense amount of work by FP2030 and Track 20 staff and partners. And I'm grateful for all the hard work by the Track 20 M&E officers and data analysts that contributed to this first FP2030 measurement report. Next slide, please. Okay, now coming back to the expanded geographic scope. FP 2020 reported on core indicators for the 69 poorest countries based on GNI per capita in 2010. As a starting point for FP 2030, we're beginning with reporting on family planning country indicators for 82 low-income and lower middle-income countries based on the World Bank categorization published in 2021. All but one original FP 2020 country are included in this reporting, and Iraq is that exception. The scope of reporting will be revisited over time as upper middle income countries make commitments and as the World Bank categories change over time. And I just want to provide a reminder that our aim in commitment making countries is for a bottom-up process in which countries work with Track 20 to review their data and progress and report annually to FP 2030. Our aim is for this country-led process to continue and for Track 20 to support those additional countries that are making commitments to examine their and report their data. Okay, so with that context about the changes in the measurement framework, let's dive into some of the numbers. Next slide, please. We estimate that as of July 2021, there were 357 million women and girls using modern contraception in low and lower middle income countries. As a result of this contraceptive use, 135 million unintended pregnancies, 28 million unsafe abortions, and 140,000 maternal deaths were averted in the past year alone. A caveat on this data, while we are reporting on estimates as of July 2021, most of the contraceptive use data and surveys that inform our estimates predate the pandemic. These are surveys that were collected in 2019, some in early 2020. And then while this survey data collection, in most cases, resumed, the temporary suspension of field work is delaying some of the usual data updates that inform our annual review of progress, and certainly our ability to understand the possible impacts of COVID. So we'll come back to that. Before we get to that, I really want to thank Emily Sonneveldt and the Track 20 team at Avenir Health for all of their work, and I want to turn it over to her to talk about a new section of the report, a regional profile section that we're excited to launch this year. So over to you, Emily.
Thanks, Jason. And we can go ahead and jump directly to the next slide so we can just dive right in. So the expanded geographical scope that Jason just described provides an opportunity to take a regional approach to looking at data. This report this year included regional profiles to highlight some of the reasons a regional approach is important. Understanding that more countries equals more diversity in terms of family planning indicators and performance, approaches to delivering family planning services, and country priorities. These regional profiles are the first step in broadening the tent for annual reporting, And the profiles establish a baseline understanding of how trends differ in these regions and starts the process of highlighting how priorities and focus areas might vary. During FP 2020, the main topic about progress was often centered around growth in contraceptive prevalence. And although that will continue in many countries, we'll also need to look beyond acceleration and include additional narratives to describe progress in countries that have already achieved high levels of MCPR. This may include discussions on resiliency, choice, sustainability, equity, accountability, and quality. So in future reports, we hope to use the new regional approach to explore these differences more and to highlight the different priorities we see coming out of countries. Next slide. As a starting point, the report this year looked at regional variation in 3 areas: population dynamics of women of reproductive age, trends in modern contraceptive prevalence, and method mix. For the presentation today, I'll just briefly discuss the second and third bullets. Next slide. As Jason mentioned, FP 2030 will now be reporting contraceptive prevalence for all women, married women, and unmarried women. This graph looks at trends in modern prevalence among these different populations over time in 3 regions: Latin America and the Caribbean, Asia and the Pacific, and Africa. The need for a regional approach is easily seen in the differing levels of prevalence between the regions. You can see that prevalence is highest in the LAC region for all 3 populations, which is the blue line. And looking at the middle graph, which is for married women, you can see that at the aggregate in LAC, about 70% of married women were using a modern method in 2020, the last data point in the blue line. Below this regional aggregate, if you look at subregions in LAC, which aren't actually shown on the graph, but if you were to look at those, the majority of married women in every subregion in LAC are already using a modern contraceptive method. This hierarchical relationship is consistent when looking at all women and married women, with LAC having the highest prevalence, followed by Asia, the orange line, and then Africa, the green line. However, there is some variation in this pattern when looking at unmarried women, which is the last graph on the right, with Africa having higher prevalence than Asia. This again highlights the value in looking at these different populations where use and need can be very different. Next slide. In addition to looking at level of prevalence, there's added value that can be seen when looking at change over time. Growth in all women contraceptive prevalence can be driven by increases in use among married women, unmarried women, or both. This graph shows the percentage point change in MCPR between 2010 and 2020 in each subregion for each of these 3 populations. What's easily seen here is that Africa, the green bars, led in growth over the last 10 years. Looking at the first graph, which shows growth in all women prevalence, you can see that all of sub-Saharan Africa grew by 5.9 points during those 10 years, and that the subregion with the biggest increase is Eastern Africa, which had an increase of 9.2 points. We see the same performance when looking at the married women data in the middle graph, with the highest growth seen in the green bars representing the subregions in Africa. As was seen in the previous slide, the prevalence in this region is the lowest of the 3. So these growth rates represent the priority put on growth in these countries and the success that they have achieved in accelerating their transition from lower to higher prevalence. The last graph shows change among unmarried women. In this case, we see the biggest increases in the subregions of LAC, which is in blue at the bottom. So these differences are driven by different levels of MCPR, different priorities, and differences in the intensity and scale of family planning programs. In some cases, we expect a similar pattern moving forward, but this is not true for all subregions. Growth over the last 10 years has repositioned some of these subregions, and the data we see in the future may represent a very different pattern of growth. Next slide. So this last slide highlights the differences we see in what methods are being used in the various subregions. The top graph shows the most common method used in countries, and the bottom graph shows the second most common method used. So let's look at 2 regional examples. You can go back to the report to look at all of the regions if you'd like, but we'll start with just the 2. So the first is Eastern Africa, which is outlined by the first box in the top graph. This shows us that in 9 countries, injectables are the most common method, seen in blue, followed by pill in 2 countries, which is orange, and then condoms and implants in 1 country each. So although there is some variation, injectables really stand out as the most common method in the subregion. So now let's compare this to South America, which is seen in the other box in the top graph. Here we see that there is a lot more variation. Pills are the most common method in 4 countries, followed by injectables in 3, and then condoms, sterilization, and other modern methods are the most popular in 1 country each. So continuing, if we look at the bottom graph, let's start again with Eastern Africa. We can again see that one method stands out. In 8 countries, implants are the second most common method, followed by injectables and pills, both in 3 countries. So again, there's a similar picture across the countries in the subregion in terms of method use. So continuing to South America, here again, we see a lot more variation. We have condoms as the second most common method in 3 countries, followed by pills, injectables, and female sterilization in 2 countries each. And then 1 country where IUD is the second most common method used. These differences reflect differing health systems and user preferences and dynamics. So all of this highlighting the different types of conversations happening in these different locations and the importance of this shift to a regional and sub-regional approach. This little bit of data included here is really just the start of the conversation and really a real opportunity to diversify the discussions we're having around data. So I'm now going to hand off to Martyn, who will talk about family planning and financing.
Thanks so much, Emily. Martyn Smith, Managing Director, FP2030 here. So the FP2030 partnership recognizes the need for continuous focus upon and improvement in the tracking and monitoring of resource flows in our family planning sector. And that's building upon the immense amount of work that happened in this area in the FP 2020 era. And we've seen great improvements in our FP financing data over time, working with more countries and more partners and with ever greater alignment in our collective efforts. And this year's measurement report presents the most recent findings from those great efforts, with the caveat, of course, that as these data relate to 2019 and 2020, they largely predate the onset of the COVID-19 pandemic. Jason will speak a little further on this in our section on COVID-19 impacts later in the webinar. So today we're going to review data in 3 areas of FP financing. Firstly, donor government funding for family planning. Secondly, then domestic government expenditures on family planning across low income and lower middle income countries. And thirdly, then estimates of total expenditures on family planning in that same set of low income and lower middle income countries. And so for our first section on donor government funding, it's my great pleasure to introduce you to Adam Wexler, Associate Director of Global Health and HIV Policy at the Kaiser Family Foundation. Over to you, Adam.
Thank you, Martyn, and good morning, good afternoon, good evening to everyone watching online. As Martyn said, my name is Adam Wexler. I'm with the Kaiser Family Foundation. I'm going to give you a quick overview of our findings from last year's report. And first, what I'd like to do is just do a very quick snapshot of our methodological approach, but knowing that I'm going to go quickly, and if people have questions or ever want to discuss in more detail, we are more than welcome to answer questions and have further discussions. So next slide, please. And one more. So we started collecting data following the 2012 London Summit, where we adapted a methodology we've been using for many years to track donor government funding for HIV. And that's a project we've done in coordination with UNAIDS. The most recent report we have presents the 2020 funding data, which is the most recent year available. And we now have data available for the period between 2012 and 2020. Next slide. So what are we covering with these totals? Well, we include funding data from all members of the OECD DAC, and we go directly to 10 members who account for the vast majority of funding to do direct data collection. And within that total, we are looking at any earmarked or FP designated amount, as well as FP specific contributions to multilateral organizations. So for instance, a donor contribution to UNFPA supplies would be captured under this bilateral total. Where possible, we also attempt to capture FP funding provided under other development assistance activities. So for instance, a project on education that may have had an FP component we would try to capture that as well. Ultimately, the data from the 10 donors we do direct data collection is validated by those donors. Lastly, we also look at donor contributions to UNFPA's core resources, and we'll be highlighting those in a minute. Next slide, please. A quick note on US data. We had a change in our methodology this past year. All prior reports presented US disbursements of family planning funding in a given fiscal year. But the current report presents US funding for family planning as specified in annual appropriations bills for the entire period. Now, there are several reasons for that change. The US budget process is unique among many of the donors, as annual funding amounts or the appropriations may be dispersed over a multi-year period. So what we've seen over time is that US disbursements fluctuate significantly from year to year. And since they're the largest donor, it drives the overall trends. We felt that the US appropriations provide a more accurate reflection of the actual political commitment to FP from the US and decided to present those data instead. Next slide, please. So what did we find in 2020? Next slide. After 3 years of increases, donor government funding actually declined by more than $100 million in 2020, reaching a total of $1.4 billion. This is compared to the 2019 level, which was $1.5 billion. The decline was largely driven by UK funding, but that itself was due to the timing of disbursements, but also partly due to a decrease in total ODA resulting from COVID-driven economic contractions. Among the donors we profiled, 3 increased funding, and that includes Canada, France, and Sweden. 4 decreased, including Denmark, Germany, Norway, and the UK. And 3 remained essentially flat, Australia, the Netherlands, and the US. These trends were the same in currency of origin, except for the Netherlands, which increased compared to the prior year. Next slide, please. This graph simply shows the trend over time. As you can see, in 2020, funding decreased. But a quick point about 2015 and 2016. As you can see, there were declines here, but that was largely driven by the rise of the US dollar against all global currencies. So when you take that into account, funding was largely flat during that period. Next slide, please. The US was the largest bilateral donor in 2020, accounting for 42% of total funding from donor governments. And the UK was the second largest donor, accounting for 19%, followed by the Netherlands at 14%, Sweden at 9%, and Canada at 7%. Next slide, please. This simply shows those percentages broken down over the overall pie. As you can see here, the US, UK, Netherlands, Sweden, and Canada account for a significant share of the overall total. Next slide. Overall, donor government funding has generally increased since the 2012 London Summit, although there have been fluctuations over the period. In 2020, donor government funding was approximately $215 million above the 2012 level, which was $1.2 billion. And funding from 6 of the donors profiled, Canada, Denmark, the Netherlands, Norway, Sweden, and the UK, was higher in 2020 than in 2012. Next slide. This figure shows in the orange line US funding amounts. As you can see here, that line is essentially flat over the period. The blue line shows funding from all other donors. And as you can see, overall, the trend has been upward with the exception of this most recent year. Next slide. As mentioned before, donors support FP activities through contributions to UNFPA's core and non-core resources. And any contributions to UNFPA's non-core resources are included under bilateral totals if specified by the donor for FP activities. Contributions to UNFPA's core resources are meant to be used for both programmatic activities, so for instance, FP, but also HIV, as well as general operational support. In 2020, donors provided over $400 million to UNFPA's core resources, which was an increase of more than $40 million compared to the 2019 amount of almost $370 million. Next slide. Germany provided the largest core contribution in 2020, followed by Sweden, Norway, the Netherlands, and Denmark. The US did not provide any funding to UNFPA in 2020 due to the Trump administration invoking the Kemp-Kasten Amendment to withhold funding, both core and non-core, from UNFPA. It's important to note that the Biden administration is not invoking that amendment to withhold funding since taking office. In 2020, UNFPA spent approximately $451 million from core and non-core resources on FP and related activities in 2020, an increase of more than 50 million compared to the 2019 amount of almost 400 million. Next slide. Data collection for the 2021 year has already begun and will continue as moving forward, with a particular effort to assess the impact of COVID-19 on donor government funding. Our next report, Donor Government Funding for Family Planning in 2021, will be made available in conjunction with the next FP2030 Measurement Report. With that, I'd like to hand it back to Martyn and look forward to questions.
Thanks. Thank you so much, Adam. So a superb run through of the trends in this year's data on donor government expenditures on family planning. So let's turn to the next two quick categories. Let's talk firstly about domestic government expenditures on family planning. So, of course, those expenditures reflect the government's commitment to its family planning program and indicate the prospects for its long-term financial sustainability. Domestic expenditures are defined as all government expenditures that support family planning, including commodity purchases, demand creation campaigns, investments in training and research, service delivery, and much more besides. And it's taken many years of work and an intensive and wide-ranging effort from a number of key partners to establish the necessary methodologies and analyze these expenditures, and then work closely with countries through their critical in-country validation processes to enable us to have them published. The data comes from three sources: from our colleagues at WHO System of Health Accounts, from the Avenir Health Track 20 Family Planning Spending Assessment, and then also from our colleagues at UNFPA in partnership with NEEDY. Great to be able to tell you that in this fourth year of reporting of domestic expenditures at the country level, the numbers of countries continues to grow year on year. And this year's table includes data for 59 countries, which is up from 54 countries that we published in last year's report, and that amounts to $1.6 billion in domestic expenditure. The 59 countries account for about 90% of the modern method users across those 82 low-income and lower middle-income countries that Jason spoke to earlier on. And it's important to note that there is a very wide range across these 59 countries, and you can see this detailed table on our website in the detailed measurement report. Countries like Indonesia and India reporting over $300 million in expenditure in a single year on family planning. 5 countries within those 59 report domestic expenditures below $100,000 for that particular year. Much more on this in our report. Please do delve into it in great detail. Please do come back to us with your questions and anything else you'd like to discuss. So we'll move on and we'll talk on the next slide about total expenditures. And total expenditures on family planning in 2019, which is the most recent year for which we have the domestic government expenditures being available in large part, are estimated at $4.3 billion across those low income and lower middle income countries. International donors contributed an estimated 45%, domestic governments an estimated 41%, and consumers through out-of-pocket spending at 14%. Of course, in addition to the bilateral donors that we see here in the international donors section, private foundations also contributed substantial and increased resources to family planning over the period and are included here. So this relative balance between domestic donor and out-of-pocket varies very significantly across the countries with which we work. And as we featured in previous FP 2020 progress reports, for example, Bangladesh, domestic government expenditure is the largest proportion. Senegal, where donor expenditure represents the largest proportion at this stage, and Indonesia, where out-of-pocket spending is a very, very significant part of the family planning expenditure landscape. And we look forward to delving into this in more detail as we move through the next few FP 2030 measurement reports. An important last point to make here is that in terms of the domestic government expenditure on family planning, this 41% of the overall $4.3 billion you can see here. Of the 59 countries that we have, it should be noted that 5 countries, Bangladesh, India, Indonesia, Pakistan, and the Philippines, account for fully 81% of that amount of domestic government expenditure on family planning. So lastly, I'd just like to say our sincere thanks to all of our colleagues within the expert advisory group on international family planning expenditures with whom we work on all of this, and particularly to Kaiser Family Foundation, our colleagues at WHO, UNFPA, and Avenir Health Track 20, and our colleagues in country for the ongoing significant teamwork in these expenditure tracking efforts. And now I'd like to hand back to you, Jason, to talk through our analysis of COVID-19 impacts within the ASEA's measurement report. Thank you, Jason.
Thanks, Martyn. And folks, please don't be shy to ask questions in the chat at any time. And in the Q&A pod, we've got several analysts, including those who are speaking today, who can be answering questions. So don't be shy, please. I want to turn now to this year's progress report's COVID impact section, which, like last year, we used to gather data from various partners to assess the impacts of COVID on family planning. Next slide, please. We posed 4 questions in this year's report based on hypothesized impacts at the outset of the pandemic. And I've listed and we'll read these questions here. The first, has the pandemic resulted in delays and disruptions in contraceptive manufacturing, shipping, and supply chains? What data do we have to answer that? Second, did pandemic shutdowns result in service disruptions in the public and private sector? Third, have there been changes in contraceptive use due to the pandemic? Either discontinuation, method switching, declines or increases in contraceptive use, or impacts on particular subgroups? And lastly, how have economic impacts of the pandemic possibly affected family planning financing? I'm just going to touch on each of these in the next few slides. And of course, there's more information in the report. Next slide, please. So on that first question on disruptions and delays in contraceptive manufacturing and procurement. In December, our colleagues at CHI and the Reproductive Health Supplies Coalition, or RHSC, published their annual family planning market report. And there was just recently a webinar on this report in which you hopefully had a chance to see these results. The report looks at shipment data from leading manufacturers of contraceptives and analyzes public sector procurement. The report found that CYPs shipped remained largely constant from 2019 to 2020. So with this preliminary data, because it only is for calendar year 2020 at that point, there were not declines in the CYPs that the contraceptive manufacturers were able to ship out to procurers. Now, this does not assess supply chains. It only assesses whether they were shipped from the manufacturer. And it doesn't assess whether products were available at facilities. So it's not a complete answer to this question. And certainly we all know the pandemic continues, but it is a sign of resilience, at least on the side of manufacturing and shipping. Let's look at facilities and what we see in data from facilities in the next slide. This slide shows data from countries, and you can see here 6 countries. The Track 20 team assessed service volumes in sub-Saharan African countries And they modeled trend data. As you know, they have trend data over time from several years to calculate the expected number of modern users in 2020. And then they have HMIS, or Health Management Information System data, service statistics data, to look at the current year and estimate the number of modern users being served. So they compare the expected, which here is the greenish blue line, with the actual services, which is the yellow orange line. Sorry, I'm not very good with colors. So in 4 of the 6 countries shown here, you can see that the actual users in 2020 was higher than expected. In the 2 countries at the end, countries 5 and 6, you can see that the actual estimated use was slightly lower. Now, this is service volume. This is services being provided. While monthly data do show some fluctuations and declines around early lockdowns, the annual data illustrate continuity in services has largely been maintained. Track 20 produced a supplemental report in conjunction with our measurement report this year that looks at a lot of additional data from these countries and additional countries. And I hope that one of my colleagues can post that link in the chat, and I encourage you to explore that report on the Track 20 website. Next slide, please. So that was about services. What do we know about contraceptive use over time? Luckily, the PMA project had already planned for longitudinal household survey analysis prior to the pandemic and had interviewed women in several countries prior to the pandemic and planned to return to interview them. They were able to return and have now done these panels in several countries. And here you see results from Burkina Faso and Kenya. So each of these bars represents a woman's response at 2 different points in time, one before the pandemic, one in 2020, and reports on their change in contraceptive status. So if we look at Burkina Faso, first you can see that at the top of the bar, 41% of those women were not using contraception before the pandemic and still are not using contraception. 26% were using contraception, are still using contraception. 6% discontinued use, and 25% adopted a new method. So they were not using and are now using contraception. So you can see that adoption here outpaced discontinuation. The same in Kenya, looking at the next bar. I will not go through each one here. You can see first that contraceptive use was higher, 69%. That reflects higher contraceptive use in Kenya. But looking at the bottom 2 segments, that you can see that adoption of contraception at 13% of women outpaced discontinuation. So women were more likely to adopt a method than discontinue in the face of the challenges of the pandemic. These data are available in scientific publications, in journals, as well as additional data is coming out from the PMA project. I encourage you to go to the PMA website, as well as to our report, where you can find the cited articles and delve into this more. None of the surveys thus far have found substantial declines in contraceptive use in 2020, and we look forward to continuing to look at this data in the coming years. And again, we're looking at a limited set of countries at this point in which the Track 20 and PMA project are active. Next slide, please. Finally, impacts on financing for family planning. You heard from Adam and Martyn that our donor and domestic tracking in this year's report, as usual, are from, we say T-1 and T-2, meaning they're from 2019 and 2020. We're looking back in time. The KFF report, if you read into it in more depth, they report that donor financing decisions that impacted the 2020 bilateral disbursements were largely made before the pandemic. And so we really do not have visibility into the financial impacts in this year's report on family planning financing. We have seen in some household surveys that great concerns and real loss in income. The PMA survey does illustrate that. And we think there's great caution needed in terms of looking at the impacts of on financing. And they should be tracked closely. They could include impacts on donors, as donors are providing needed resources for other health areas, or as GDP declines and donors may have less to give. They could include impacts on domestic ability to spend on family planning as resources are diverted to other health areas, and certainly on out-of-pocket spending as incomes have been affected during the pandemic. I will say that all of our section on COVID impacts is a work in progress, and we look forward to working with partners to continue to aggregate data resources on the impacts and the responses to COVID-19. And we look forward to hearing from you. You can send us data on and reports on impacts, and we will continue to share that widely and use it in coming years' reports. So thanks to those who have contributed. So with that, I want to turn away from the data and talk about the online resources that we do have available. We're just today looking at the tip of the iceberg on online resources. Many of you participants have asked over time for more and more data, and we're proud to respond to that. Next slide, please. What you can find on the FP2030 website are first, the FP2030 transition report, Becoming FP2030, that provides a lot more information on the transition, governance, regional hubs, and more. That was published in November, available on the website. The measurement report that we discussed today. There are full estimate tables for those who love Excel. We have full estimate tables for all of our country indicators, including regional aggregates. There are uncertainty estimates available in a separate Excel file. The Track 20 has a great set of country family planning indicator summaries, English and French, and Spanish is soon to come. We have all of the supplemental adolescent and youth data, and we have 2 data dashboards, one on the country indicators, one on the adolescent youth indicators that are currently being updated and will be available soon. We continue to respond to the requests that we hear. Let us know what you'd like to see, and we'll do our best to provide those resources. Of course, we also have all of the graphics available in various forms should you want to use these, present these. They are available in JPEG forms, in PowerPoint forms, and others. So thanks for continuing to make those requests, and we'll do our best to respond. So I want to turn now to our Q&A session. We do have more than just the 10 minutes available. For those that are that don't have a conflict, please feel free to stay on the line. We have about 20 minutes in which myself and other panelists, as well as our data analysts who are supporting Q&A, can respond to questions. And so I'm going to tinker around with Windows here so I can see some Q&A and possibly pose a few of these questions to our to our panelists. And let me just move one thing over here. Sorry, while I move some windows around. And thanks. I see a question from Halima on on expenditures on family planning by governments in low middle income countries. And the question is, does this expenditure, here we're talking about domestic, show an upward trend or sinking deeper into donor dependency? And she mentions that she believes domestic funding would indicate government's commitment to family planning. Martyn, can I turn to you on that one?
Thanks, Jason. Thanks so much for the question, Halima. So we report that this is our 4th year of domestic expenditure reporting. That doesn't yet mean that we have 4 separate data points for each and every of the 59 countries that you see in the table. And we will be working towards a publication of some of this trend data in future years. But having said that, some key points emerge. The general answer to your question is it's an incredibly varied picture across the 59. That's not a good enough answer. So a further answer would be that there are some very encouraging signs in certain lower middle income countries. And we remember, of course, that all of this data is pre-pandemic and fiscal space will have been squeezed in 2020 and 2021. But based on this, these data, 5 big Asian countries with very, very significant proportions and rising proportions of domestic expenditures on family planning: Bangladesh, Pakistan, Indonesia, India, and the Philippines. And then also some very encouraging recent data from certain sub-Saharan African countries within the LMIC group. Côte d'Ivoire, $44 million rising amount in domestic expenditures on family planning in 2019. Your own country of Tanzania, Halima, $46 million spent as per the 2019 WHO System of Health accounts. But then we do see real tightness, really some really tough numbers, I would say, particularly in low income countries where it is clearly proving really quite difficult for commitments to domestic financing of family planning allocations to actually result in expenditures. We're working extremely hard with FP2030 commitment making countries. That domestic financing that you rightly point out as a very important part of government's commitment to family planning is a central piece. The domestic financing of those FP2030 commitments, 13 have been launched. They're all being published on our website. We'll keep working hard on that. And we do really want to then bring through some further, more detailed analysis of this in future FP2030 reports. It's it's a key element of our measurement framework going forwards. I hope that's a reasonable enough answer for now, Halima. Back to you, Jason.
Martyn, while we're on domestic expenditures, another question, this from Monica, on whether we'd consider a separate webinar on financing and particularly domestic expenditures. She asked, she was particularly surprised about Ghana low and Indonesia high, and asked if this reflects subnational data. And then a follow-up question was whether out-of-pocket expenditure has changed over time. Why don't we just sort of close out on domestic expenditures there?
So a webinar delving into this in great detail. It's an excellent idea, Monica. We'll chat to our expert advisory group on international family planning expenditures. We draw that expertise from that group. Your question, on Ghana and Indonesia, we can certainly delve into a lot of detail. Indonesia, we do have the family planning spending assessment that our colleagues at Avenir Health Track 20 do, so we can actually see from their analysis what's happening with domestic expenditures in relation to both to donor and out of pocket. So we can certainly look at doing that. With regard to out of pocket, so out of pocket is at about $608 million across the 82 countries. I would say that, and I'm speaking on behalf of Avenir, Health Track 20, and RHSC, and a whole range of colleagues in saying this, but I think our estimates are getting more accurate over time. It's based on the latest LEAP report that came out from RHSC just a few months ago. And so I believe that accuracy has improved significantly over the course of the last few years, because of our understanding of usage in the private sector and the price points therein. But I believe will become ever more accurate in our out-of-pocket understanding. So back to you, Jason, but great idea, Monica. Thank you.
Great, thanks, Martyn. I'm going to change gears here, and I see a couple of questions about the PMA longitudinal data. Would have been great to have another panelist on, and I think I'll have to encourage our colleagues at PMA to do a webinar specifically on this data, seeing that there's so much interest. We are just presenting a glimpse of those longer publications. So a few answers that I'll take here, since I know the data well, and I'll have to ask my colleagues at PMA to, Phil, there you are. Good. If I get this wrong, Phil, please feel free to chat. They do have data on method switching, which I did not show here. So asking women whether they switched between those. Those people, Eve Brecker, you asked where would they be captured? They would be captured in continuing use. However, the PMA team has looked at switching. It is not, it's not the majority of those users. So the majority of those continuing users are using the same method. So I think that's, I hope that's clear. I think that answers Eve's question. And I believe that Ann Stars had a question on switching as well. Phil, maybe you can chat on the results from other countries. I know this analysis is ongoing. At the time of the report, we just had Burkina Faso and Kenya that were published in journal articles. I know you have additional data. It would be great if you could chat in a response on the additional countries, as there's interest from several folks in there. And I hope you'll be able to do that. Thanks in advance. Great, it's great data. There's also data on fertility intentions. There's data on income. So I really encourage a deeper dive into that for those of you who want to look into those articles. All right, we do have a couple more minutes for those who are able to stay on the line. I see a question here. Well, actually, I wanted to turn to a question. I don't know, Emily, if you're able to stay on. There was a question about that I know was answered in the Q&A pod that was on Dmpasc, and I see that Priya also mentioned the Dmpasc data in DHIS2. Do you want to say a word about tracking Dmpasc, where we're able to do it, and what data are available at this point in time?
Sure. So there's two main sources that we have to understand the dynamic between which types of injectables are being used. And those are the PMA data. And so the countries where they collect information, we can get a glimpse into that dynamic. And then a very, very few countries, we can get an understanding of what that looks like in terms of from HMIS data. And those countries are a couple in West Africa. I'd need to actually just go back before I name the countries and make sure I'm saying that correctly. So if anybody wants to know, please send me an email and I'll pull that out of my notes to make sure I don't say it incorrectly. But we've only come across a very small number of countries, and the data is very, very new. So we don't have a lot of trend. And what we find in HMIS data is when a new data element is added, you often see sort of a lot of noise in the numbers at the beginning. So even though that data is starting, it'll probably be a little bit more time before we have a full understanding of what that data is actually telling us. But we are starting to at least see an interest. So we don't know much yet, but that movement does seem to be starting.
Thanks. And one nice addition that we will see in coming years is that my understanding is that demographic health survey in the new women's questionnaire will be asking about, I believe, about self-injection. So we may, as that new survey is rolled out, we may gain additional data from that as well. It could take a long time before we have more countries that have that data. So good to have seen that added in into the DHS module. And so thanks. Lively chat going on, so I'm not going to try to keep on top of that. I do see a good question for you, Adam, on inflation. Does the report include information on the impact of inflation over time, given the flat real dollar trends in some donor funding? How do you handle currency fluctuations thus far, or how have you handled them?
It's a great question and something we consider all the time. We do use DAC deflators, which is data points put out by the OECD DAC, to take into account some of these aspects of fluctuations over time. And we have just some broad statements on what those trends were. Essentially, we saw that funding from donors was the same when taking those, calculating with DAC deflators, with the exception of the Netherlands, which actually increased. But one thing that I would like to highlight along that line, it's a very difficult thing that we've wrestled with over time on how to assess is, so you have a donor operating in many different countries, and maybe the funding has been flat, but what has happened with the expenditures in those countries as the exchange rate has changed, and being able to calculate every expenditure in every different country and doing the exchange rate fluctuations at the time of disbursement is not something we've been able to do and is a particular challenge. So for instance, when the US dollar was going up against all other currencies several years ago, what was the overall impact on that? Similarly, if there are other countries where their valuation has declined against other currencies, what impact has that had in country? That's just not something that we've done, but is one of the key things that we'd like to do. It's just a challenge of getting that data accurately and timely. But it's a great question and a good point. Thank you.
Thanks, Adam. I see lots of questions are getting answered through Emily's intervention and our data analyst Shiza's intervention in the Q&A pod. You can see some of those in the Q&A pod as answered. I did see a question that Megan had posed on family planning integration and the data collection. Megan, we do not have specific country indicators amongst our core set on family planning integration, particularly postpartum family planning and post-abortion family planning, which we have certainly done data analysis on. The Track 20 team has a lot of analysis on that. I encourage you to reach out to the Track 20 team. We also have encouraged, rather than looking at survey data necessarily to see increases, there was a group that suggested that there be very specific HMIS indicators collected for immediate postpartum family planning. We have guidance on that available on the FP2030 website. And would be happy to share that with you. So countries are collecting that data largely in HMIS systems, and we hope over time to see through an alignment on indicators, we hope to be able to track those trends. I did see a question that was on the PMA results and what does adoption mean? Someone did ask, is that new contraceptive users, people who are new initiators and never used contraception? I just want to answer that quickly and say no. These are asking women at 2 points in time, those who were not using contraception at the first point in time, and then those who then were using it at that second point of time. We do not ask about, or did not ask about previous use. So it could be that they've never used contraception before. It could be that they have contraceptive use experience and are just returning to use again. So that is why we're not saying initiation or new use, because we don't have that information. And Phil and I talked quite a bit about how to accurately reflect that. So I think we did, I hope we did an honorable job in answering all those questions. You know where to find us, and we love getting data requests. Track 20 team, the PMA team, the KFF team, and here at FP 2030, we stand ready to answer questions, get the data to you that you need in various formats, and continue to work with you on tracking family planning progress, as well as the impacts of COVID-19. It's really an honor always to work with the data teams, but also the Track 20 M&E officers who are such a critical part of this. I hope that some of you were able to join us today and see all of your efforts in these global and regional snapshots. It's really a pleasure to bring light to all the hard work you do at the country level. With that, I'd like to, if Samu is still with us and wants to say a closing word, Samu, you are of course welcome.
Thank you, Jason. I was actually writing down that. Thank you so much, everybody, for this. It's quite insightful when you hear what the work, you look at the work that has gone in bringing this report to reality and the insights that are being provided there. I love the questions that are coming out, and would certainly take all of them, collect them, and see whether we could do something, going forward around these. Thank you so much. We do appreciate. Do have a lovely day further, everybody. Thank you. Thank you.
Bye. Thank you.